Thank you. So it's a real privilege to be here, and I'm a little bit nervous, so I do apologise. But good afternoon. So my name's Susan, and I'm here representing the National Clinical Home Care Association, which is the trade body for home care providers, and it's probably worth me explaining what that means. So our submission here just describes a report that was commissioned, and it's right here. I call it the pink report because it's all pink. I'll just talk a little bit about the background to this, though, before we move on. So the report aimed to explain what home care, clinical home care medicine services are all about, because they're really complex services, and the idea was to raise the profile of these services to the NHS decision makers and government, because that's where it needs to go. So basically, patients who have chronic stable conditions receive their medicines and any nursing care that they need in the comfort of their own homes. Don't know whether any of you are aware of that, but we do have 623,000 patients that we look after. The spend is £4.5 billion, which is 30% of the NHS medicines budget. Now, it could be more. The market has grown 20% year on year for the last few years, but there is capacity in the market to do a bit more. The National Clinical Home Care Association is the trade body for the home care providers. They're the independent companies that the NHS commissions to provide those services, and they make sure that services are safe, cost-effective, and integrated. And as you can imagine, the transfer of care needs to be seamless. We cannot have any patients falling through the gap. So when I say chronic stable conditions, I'm a pharmacist, by the way, so it's all pharmacists speak. But when I say chronic stable, that means things like HIV, transplant, rheumatology, so rheumatoid arthritis, ankylosing spondylitis, gastro diseases, Crohn's, ulcerative colitis, dermatology, psoriasis, etc., and many more. We also have home parenteral nutrition, we have home dialysis. The breadth of services is huge, as you may imagine. So home care services can only be successful because there's collaboration between the partnerships. I said it's very complex. So we have the NHS, home care providers, patients, and the pharmaceutical industry, who are all important stakeholders. The report was called the best kept secret because actually people are not aware, including in NHS England and Department of Health and Social Care, that these services exist. So as I've said before, the report aims to give an overview and highlight, raise the profile. There was a targeted media campaign which reached 15 million people, and this report was launched on the 19th of March. Patient groups were involved. We have the NCHA Patient Advisory Council, which meets regularly, and we've done various speaker engagements to raise the profile. Now, there is a link to the full report if anyone's really interested, or come and talk to me, because I could talk all day about home care. I've worked for the last 14 years in this sector, 13 of which in the NHS, heading up the National Committee, and then for my last year, since 2023, I've been inside a home care provider, so I've seen things from both sides. So with our report, we wanted to look at the health economics and focus on the patient factors as well as economic factors, and also see how the NHS could exploit these services for the benefit of more patients. So the report does focus on some of the NHS key priorities, which we've heard mentioned already, haven't we? Reduce waiting times, releasing appointment times, and gathering testimonials of good practice from clinicians and also from patients. We had an amazing steering group which oversaw the project, and our esteemed chair was Mark Hackett, which some of you who in the home care world may know wrote one of the first reports back in 2011, Home Care: A Vision Towards the Future. So if we look at some of we've got an amazing quote there from Mark. So if we look at some of the outcomes, these are the top lines. Patients, 62% of patients say that having those services helps them stay in work and education, and then they can maintain their valuable contribution to society. 85% of patients say that they have their medicines explained to them, and as a pharmacist, that's very dear to my heart. 75,000 patients if they didn't access these services, they'd be making a 40-mile round trip every time they needed to collect their medicines from their hospital, because these are hospital-specialised medicines. The average distance that people live from their local hospital is 16 miles when we're talking about our specialist services. If we use a home care delivery mechanism, that average journey time is cut down to 6.9 miles because we can do van deliveries in a particular geography on a certain day. There are 3.2 million deliveries that happen every year to these patients, which is, I think, is absolutely incredible. So, and if we calculated the amount of time that is saved in hospital outpatient appointments with infusions, and it's 15 NHS trusts worth of hospital appointments time, infusion time that is saved through using these services. If we look at, I'm going to skip some of these because there's loads of slides. I'm going to click through these, hopefully, and get to some patient data. So 804 people were independently interviewed. Roughly half have access to services and the other half weren't using these services. And these are their results, which I think are, well, amazing, really. We should have a look at the figures. So positive impact on health, 79%. I'm just going to pick out a couple. A positive impact on the ability to get on with life. 75% of people say that clinical home care helps them. Just, I think, amazing. If we look at the financials, there is and this is a conservative estimate, £264 million saving every year for people who use these services. And if we could exploit that and actually increase the number of people accessing these services, that can only benefit society. We'll move on. Some of the recommendations. So we've seen that not only do patients have a health and lifestyle benefits, we've got those financial benefits as well. But I wanted just to pick out a couple of recommendations, just two. Number 1 and number 5 are the ones I'm going to concentrate on. So there has been an agreement that we will share some of the aggregated anonymised data into the public domain. So we're just waiting on NHS England to tell us which bits of data, because we have a national KPI data set that is published within the industry, but it's not published to the public. So we're definitely going to do that. We're waiting on NHS England to tell us which bits of data set they would like us to publish. And then number 5, standardisation across the industry. Because of the nature of the services, we do need to standardise. Now, that doesn't mean that people don't get personalised care, because that also happens, but we do have to have a standardised process. There's also a need to embrace digital technology. For those of you in the pharmacy world, you may know that the NHS works on paper prescriptions and they arrive at these home care providers by the post, because actually having the digital solution is quite difficult, as the prescription is a legal requirement. I won't bore you with that, but if you want ask me any questions, you can do. But there are regulatory restrictions why it's quite difficult to get a true electronic prescription from an NHS hospital to one of their home care providers. But it's not all doom and gloom. So, what I can say, having worked on both sides of things and working with industry as well, is that actually all the stakeholders that work in this world are completely committed to the patient. And what we want to do is provide patients with a fantastic experience that allows them to get the best out of their medicines and the best out of their care, but while producing savings to the NHS and to the whole health economy. And I know that we'll all continue to work together to make that better. So we're absolutely delighted to be here today, and to have won the award is slightly, I don't know, I'm slightly nervous, but there we go, it is great. But thank you very much.